All right. Okay, so I'll get started. I'll just admit people as they come in here. So welcome to this Meetup event. Today I'll be talking about neural retraining for chronic health conditions. Hopefully this topic is a familiar one to you. If you feel like you are here in error, if you have joined the wrong Meetup event, you can go ahead and just end the meeting for yourself and leave. My name is Madeline Lowry. I am based in the Twin Cities. I was originally trained as a nutritional therapy practitioner, which is kind of a functional nutrition approach to chronic health conditions. Then I started to work with different types of neural retraining and including the MAT method, which is what this stands for, Certified MAT Method Practitioner. And so today we'll be talking about how we use neural retraining to address chronic health conditions. Okay. Again, if you are just joining us, please go ahead and put yourself on mute. It helps with the sound quality. Thanks so much. All right. So to start, I'll just go over our agenda, the topics that I'll be addressing today. So the topic is neural retraining for chronic conditions. And we're going to talk about how the mind influences health. We're going to talk about a few different mind-body approaches. And then I will talk about the MAT method of advanced neural retraining. That is the one I know best because that is the one I practice. And then I will talk about the role of trauma, repression, and stress on chronic health issues. Then we'll talk about the applications of the MAT method for chronic health conditions, how I have used it, the kinds of things that I see in my practice. And throughout this presentation, which is really going to be a brief overview, right? I could talk about any one of these topics for an hour. I will be pointing out different resources that you can utilize if you would like to learn more on your own. Okay. All right, good. So the first thing that, I want, when we talk about the mind and its influence on health, the first thing that I want people to understand is the role of the stress response, right? So it is essential, right, that we understand the autonomic nervous system and how it is that we are wired, right, from evolutionarily speaking, how we are wired so that at any point in time, our body is running in one of two modes, the sympathetic mode of the autonomic nervous system or the parasympathetic mode. In the sympathetic mode, we are gearing up to run away from an emergency. You may have heard of this described as fight, flight, or freeze. In the parasympathetic mode, the body is running the functions, right, of the body differently. And all restorative functions that happen, including digestion, including nutrient uptake, including hormonal balance, fluid balance, neurotransmitter production, wound healing, all of the functions that you need to sustain life are in homeostasis when we are in the rest, digest, and heal mode of the autonomic nervous system. It's a very ancient, very hardwired dichotomy. And what I want you to understand is that your brain is tasked, particularly the limbic system of the brain, the danger sensing part of the brain, is tasked with figuring out at any moment, are we under threat or are we safe? Can we relax? Can we digest our meal? Can we detox? Can we eliminate? Can we reproduce, right? So that limbic system of the brain, old structures of the brain, are analyzing information, 40 million bits of information per second. That is what your subconscious mind is capable of. everything that is happening out here and everything that is happening in here, right? Including our thoughts and emotions. So the body is designed to be self-healing. But when it is not able to heal itself, right, then we understand there's something going on in the mind that may be impacting our ability to heal. And a lot of the time we see that, you may have heard your functional medicine practitioner describe or advise you that, it looks like you are sympathetic dominant. That is what we mean. We are too easily triggered into that fight, flight, or freeze response. All right. If you're just joining us, please go ahead and mute yourself. It really helps with the sound. So I will just carry on here. How does the mind influence health? So thoughts and emotions. I just described how the limbic brain, the danger sensing part of the brain, will assess, what is going on in the mind in order to make that determination. Should we be in fight or flight, or should we be relaxed, heal, rest, digest, and heal? And so if that person can mute themselves, that would be great. And so what we know, right? What we know about the mind's influence on health is that most people would describe that stress makes their symptoms worse. It's a very common observation. We also know that emotions have physiological effects. If you've ever felt embarrassed, you may notice kind of flushing that happens, right? If you feel under threat, you may notice kind of a churning happening in your stomach. When you feel anxious, stressed, panicky, you may notice sweaty palms. You may notice that it's harder to breathe, right? So emotions have physiological effects. We're all familiar with this. In fact, we reflect this in our language when we say, how do you feel? We mean, how do you feel emotionally? And also, how do you feel physically? We use the same word, right? So definitely the emotions make themselves known in the physiology as well. So in addition to thoughts and emotions, beliefs and expectations also affect our physical health. You may have heard of the placebo effect or the nocebo effect. What is the placebo effect? For over 50 years, we have seen in clinical trials that when we have a double-blinded experiment where there's an experimental group that receives the drug or the actual therapy, and we have a control group that receives the sugar pill or the sham surgery, or nothing of therapeutic value is being offered to them, only they don't know who is in the experimental group and who is in the control group. It has been seen over and over and over again that people in the control group will improve. They take baseline data, and then after the trial is over, endpoint data, and they will see that people in the control group can improve as much as people in the experimental group based on the belief and the expectation that they are being given something that will improve their health, their outcome. So this shows the power of the mind. Not only can it be used to your benefit, the placebo effect, but it can also be used to your detriment. And that's what the nocebo effect is. When a person is given a dire prognosis and they believe it, this can have the opposite effect, right? It can have a negative effect on your condition, on your state of health. A couple of books that I would recommend if you are interested in this are Mind Over Medicine, or You Are the Placebo, and these are listed here. All right. So now I'm going to talk about a few mind-body approaches very briefly. So Dr. John Sarno, Western trained physician, I don't know how many of you are familiar with him. He wrote about the effect of repressed emotions on chronic pain syndromes. He was trained, as I said, traditional Western medicine in about the 1950s, about the time when the medical paradigm really shifted over to biochemistry and pharmaceutical causes or approaches to dealing with disease and conditions. He practiced medicine at NYU's Rusk Center for Rehabilitation. And for the first 8 years of his practice, remember, he specialized in chronic back pain, so he saw lots of people with chronic back pain. He used all the usual tools, pharmaceutical drugs, physical therapy, and surgery sometimes. And after 8 years, he decided he needed to try something else because he didn't feel like his outcomes were really that good. And he started to look at the role of the mind. He switched his whole practice over to being more educational, and he taught people about the role of the mind and the role of repressed emotions in chronic pain syndromes, like chronic back pain. And he found this much more effective. So his theory was that, he talked about the repressed emotions of the perfect and the good. So he said for people who have to, are conscientious, they're accomplished, they're successful, there is something that we have to repress in ourselves in order to perform at that high level, right? And what do we push down? In his view, right, we push down things like frustration and anger and rage. And so his feeling was that chronic pain is created by the mind as a distraction from feeling these unwanted emotions, right? These sort of unsavory emotions that we have had to kind of push down or away, in order to continue doing what we are doing, performing at that high level and being socially acceptable. So his writings, he wrote several books about this. The first one was all about back pain. Then he started to broaden his ideas further. And in the Mind-Body Prescription, his next book, he starts to talk about all the other kinds of chronic health issues that he also thought were related to repressed anger and rage. And then he wrote the book, The Divided Mind. I think that was probably his fourth and last book. And that, takes his theories even further. I think he's right. And a lot of people since Dr. Sarno's work have also talked about the role of repressed emotions and the role of repressive personality traits, that create those repressed emotions. But I would say in my practice, it's not all about anger. It can be any negative emotion. And I would say that the pain is not so much a distraction from those emotions that we don't want to acknowledge. I would say it is very much those emotions making themselves known. Like there is something here you need to deal with. And, I'm going to keep, anyway, until you deal with it, until you release or process these emotions, this is going to be a factor in your pain. I wouldn't say it's the whole thing, but it can be a factor. Dr. Joe Dispenza has written several books about the role of the mind in chronic health conditions. He believes that chronic conditions are sustained by patterns of thought, right? And his recommendation is a lot of meditation, right? To become more aware of what it is that we are thinking, the habitual patterns of thoughts and emotional responses that are contributing to chronic health conditions. So while Dr. Sarno was really about education and then teaching people, to journal and to do these kind of journaling exercises where they would dig deep into the lifetime of experiences to try to ferret out, where is it that I may have been repressing or suppressing my feelings. Dr. Dispenza's approach is more about meditation, stilling the mind, and allowing awareness of the patterns, right? The patterns that we are running. And then allowing, through meditation, somehow allowing this to break down or to be dissolved, released. So DNRS is the next one I want to talk about. A lot of people come to me after trying DNRS, Dynamic Neural Retraining System. This is a method created by Annie Hopper in Canada. She was trained as a counselor, or I guess that's the Canadian word for psychotherapist. And she created this method to deal with her own sensitivities. So she developed, all of a sudden, kind of out of the blue, she developed a lot of severe sensitivities to foods and chemicals and mold and electromagnetic fields. And she was trained, in being very self-aware. And she recognized that though she was unable to live in her home any longer because of all of the sensitivities she had, nothing about her house had actually changed. And her husband seemed to be able to live there with no ill effects. And so she started to look at her mind and what could have happened, could have changed about her mind that would be affecting her so severely. Anyway, so she came up with this method. She retrained her brain and developed that process into a method that she calls DNRS. This is a method that requires, again, a big educational component, right? You watch 14 hours of video. Then you are trained to do some mental exercises for an hour a day for months. And some people do this for years. The mental exercises are like repeating scripts and affirmations and visualizations. And for some people, this is very effective. Effective for overcoming sensitivities and also other kinds of health issues. But for others, they kind of, it's not enough, right? Maybe they see a little improvement at the beginning, but then that kind of plateaus or regresses. Some people even say that they feel more anxious the more that they practice this. I would call this a basic method of neural retraining. Again, anytime that we're using the conscious mind and we're repeating like affirmations, scripts, we're trying to use the conscious mind to affect something going on in the subconscious mind. It's a long road. It takes a lot of effort. Advanced neural retraining methods can be indicated, I would say for anyone who's been practicing DNRS for more than 4 to 6 weeks and is not really seeing an improvement, you probably need something advanced. So then we have the energy psychology techniques. There's so many more that could be talked about, but anyway, I'm just kind of trying to hit some of the major ones that you may have heard of. So energy psychology techniques like EMDR and EFT. EMDR is eye movement desensitization and reprogramming. EFT is also called tapping, right? So these are techniques that were developed in the 1980s, I would say. And, it has taken several decades for them to really become more popular, more accepted. EMDR is often, people are often referred for EMDR sessions when to overcome trauma, to fully process memories around trauma patterns, PTSD. So EMDR is a technique that uses bilateral stimulation, maybe eye movements or pressure from one side of the body to another in order to enable the release or the processing of some trapped or stuck unprocessed emotions that accompany a remembered trauma experience. EMDR is very effective. Some people find it a little too much. They find it's hard. It can be hard, especially for a very traumatized person, to be willing to go back and rehash these memories very vividly. And so, I do not practice that, and I have never been in an EMDR session, but these are the things that my clients tell me. EFT is a tapping, it's about tapping on acupressure points. You may have learned a technique like this. Again, the idea is that we are trying to release blocks that are keeping emotions trapped or stuck. And I think it's another very helpful skill to learn. A lot of people learn it and they find it helpful in the moment. I just think that for some people, we need to go deeper. The patterns are deeper than that. They need more. They need a more advanced technique to kind of surface them. So again, referring you to some resources here. So let me just briefly talk about the MAP method. This is the method that I know the best. This is the method that I practice every day. It is a method of advanced neural retraining. If you understand EMDR and if you understand or have tried EFT, this is the next generation energy psychology technique. It is a meditative technique in the sense that during a session, you'll have your eyes closed for most of the session, breathing slowly, deeply, and gently. You'll have a focus. In the beginning, I may have you focus on your breath, but then at a certain point, I may have you focus on a particular memory. Maybe, for example, if you come for a session on anxiety, look for a memory around that you can feel into, that you can focus on. Maybe the first time you felt anxious, the worst time, the most recent time, something like that. With the MAP method, we are able to work directly with the subconscious mind. This is what makes it faster, a faster process. Every session, in each session, we pick a topic. Like I said, it could be a painful memory. It could be a symptom. It could be a known trauma from childhood. It could be a personality trait or a pattern or behavior that you want to break. So every session is focused on a topic. And in each session, we are trying to resolve a subconscious source of stress. And through the effects of through the cumulative effect of several sessions, these patterns start to break down. In a session, it's a self-healing process, right? Your brain is rewiring itself. What does this feel like? It can feel like REM eye movement. It can feel like tingling somewhere in your head or somewhere in your body. It can feel like you are aware that your mind is working on something. There's some processing going on, but you can't really see what it is. It can feel like, dizziness or some kind of sensation going on in your brain. Generally, this is, I would say, that is a pleasant experience. There is no equipment that's required except what you need to join Zoom. So a phone, iPad, laptop. You do not have to believe in anything. You do not need any special skills, and there is no practice required. Unlike DNRS, you do not have to practice. scripts and affirmations and things afterwards. Though there may be insights that you gain in a session that will require that you be maybe more attentive or aware, and may motivate you to change, how you are in certain situations. That's only kind of practicing, really. Sessions are done over Zoom, as I said, and I would say that the method is complementary to traditional medicine or alternative methods, whatever else you are doing. I feel like MAP sessions, in a MAP session, we are working with the person and the personality. So we're not treating disease. We are working with the person and the personality to optimize healing ability, right? So it's a different kind of focus than what you're getting with other practitioners. And for some people, it's like the missing piece of the puzzle. So how do sessions work? As I said, each session, we pick a topic. We aim to resolve a subconscious source of stress. In a session, as you are relaxing, you're meditating in a meditative state, focusing on whatever we've chosen for the focus. The practitioner is offering verbal instructions to your subconscious mind. And your subconscious mind is starting to show you things, associations. Different memories may come up for you. You may feel sensations in your body. Emotions may start to arise for you. Words, insights, right? So different things start to come up in the mind, and you notice them, much like in meditation. Thoughts are coming into your mind and you observe them, you let them go, but you note what's coming up. And at the end of a few minutes of having, had this process, having the instructions be offered to your subconscious mind, I ask you for some feedback. So what came up for you? What did you feel? What did you notice? What words came up for you? Did you feel anything in your body? And based on your feedback, this allows me to see where we need to go next. There's also a kind of empathic connection. This can be kind of hard to understand unless you've done other kind of energy-related work. There's an empathic connection that the practitioners are trained to be able to make with the client. And through this intuitive connection, you could think of it as, we are able to kind of pick up, we're able to get like yes and no answers to the questions that we ask. So we are muscle checking. If you're familiar with muscle testing, it's kind of like that, except I don't have to push on your arm. I push on my arm, figuratively, to come up with yes or no answers to the questions that I'm asking myself through the session. Questions like, what is the priority for this session? You may have come into the session with 2 or 3 ideas, and I have to muscle check myself to figure out, what is the priority for this person and for this session today? Or just in being able to figure out, where we need to go in a session. I'm using muscle checking to kind of tune in to what is going on in your subconscious mind. I can't see what's happening in your mind, but by asking yes or no questions, I can help to navigate. And that can be very helpful, because for someone who doesn't have a lot coming up in the mind, it still gives me something to go on to be able to guide the session, right? So again, there's no special skill that you have to have coming into this. In a session, we are trying to neutralize emotional intensity around particular memories. Why is that important? Yes, of course, it is nice to neutralize the emotional intensity around something painful that's happened to you in the past, or something, a trigger that maybe causes anxiety for you in your current life. But, it's not just about neutralizing the emotions around that experience. Every memory is connected, is associated to other memories. And so really what the MAP method is doing is we're taking an entry point and we're saying, okay, focus on this example of where you felt anxious. And then we're asking the subconscious mind, do you see this memory? No, I want you to look for all the associated memories that have felt the same way and neutralize them as a group. Neutralize the triggers that go along with these memories, et cetera, et cetera. So really, what we are doing is trying to neutralize clusters of memory at the same time. and the programming that is associated with these memories. This is not about inhibiting your ability to feel certain emotions. No, that's not the purpose here. But by neutralizing the emotional intensity around a particular memory, we downgrade the importance of that memory and the associated programming in the operating system of your mind, right? If you can think of it that way. Our minds are designed so that any experience that we have that has high emotional intensity is held in the highest levels, the highest level of priority in the brain. And so is the associated programming, right? So that is the importance of this. People who do multiple MAP sessions tend to see emotional improvements first. First 2-3 sessions, we're working on an emotional level generally. Then we get to the mental behavioral level. And then sessions 4, 5, 6, we are starting to see shifts on a physical level. Why is that? Because by the time something has become physical, a pattern is is affecting you physically, it has been there a long time, and there may be multiple ways in which it has been reinforced. And so it just is, it requires a cumulative effect of several sessions to see improvements on a physical level. So aside from the MAP method, which is a technique that I use, I like to describe it as an open technique, right? Because every practitioner brings to the method everything that they already know and have been trained in, right? So different practitioners have different things that they bring to the method. And because I had already been working with people who had chronic health issues, trying to use nutrition, dietary changes, lifestyle changes, and supplements to help them recover their health, I already had that interest, that perspective. And so I bring that to my work with the MAP method. So what I'm going to describe now is just the paradigm that I personally use in addressing chronic health issues with advanced neural retraining techniques. You may recognize this as being similar to what Annie Hopper describes in her book, Wired for Healing. As you may remember, she was the person who created the dynamic neural retraining system. So what I understand as a practitioner about chronic health issues is that there are multiple contributors to it, right? There's a paradigm or a model that we can use, starting with early childhood experiences, traumas, or painful early childhood experiences are important. They are very impactful, right? Because when we are young, it's like all those patterns are just being created. The operating system of the mind also is being created. And so early life experiences tend to have an impact that lasts for the rest of our life, unless we make a concerted effort to change that. Also, for people that are more sensitive, here I'm talking about the highly sensitive person, the empathic person, it doesn't take as much trauma, or ACEs. ACEs stands here for Adverse Childhood Experiences. Some of you may be familiar with that work that was done by the CDC and Kaiser Permanente. This was a study done in the 1990s that showed that people who answered, a simple 10-question survey on which of these adverse experiences did you have before the age of 18, people who had moderate levels, so if they answered yes to 4 or more questions, this was highly correlated to lifetime chronic illness risk. or predisposition for chronic illness. And by this, I mean emotional, mental, physical, addictions, early death from any cause. So definitely, right, that study in the 1990s definitely brought to the fore, at least in this country, the connection between early life trauma. And, it kind of sets the stage for chronic, just to be more susceptible to chronic health issues later in life. Why is that? Partially because those early experiences can form patterns, form personality traits that are emotionally repressive, right? So we develop emotional coping styles that are detrimental for us. We become a people pleaser, a peacemaker, a conflict avoider, a nurturer, a chameleon, right? Any number of things. And these are detrimental because they require that we sort of deny ourselves, our own needs, our own feelings in the service of others. Then what we see is that there are often stressors, right, that lead to the onset of the diagnosis or the worsening of symptoms. And so in homeopathy, they talk about never well since. And this is kind of the same thing, right? So people will recognize, yeah, my symptoms got worse, or I got the diagnosis after this period of stress, or after this thing happened to me, after I had that infection, after I took that course of antibiotics, after I was exposed to X or Y, after my marriage failed, after my mother died, after, right, some kind of emotional, physical, infectious, or chemical stress. And then we have the contributors of current life. So current life stress. And so when I work with people with chronic health conditions, these are the kinds of things that I'm looking for. These are the kinds of topics that I'm looking for, and that would be good to do a session on. So you can see how it can take a number of sessions to kind of start to unpack all of this, unwind all of it, to a point where you can feel not only emotional improvements, but then mental behavioral improvements, and finally physical level improvements. All right, I'm going to keep going here so that we can have some time for Q&A. Just very quickly, we've talked about some of this, some essential concepts about the MAP method. Again, remember, this is an advanced method of neural retraining. It is a self-healing process. Your brain is rewiring itself, facilitated by the practitioner. The practitioner is there to offer instructions to your subconscious mind, but your subconscious mind is in control of the session. No rewiring can be done that is contrary to your goals. No rewiring can be done that, isn't safe for you to do in that session. It is, it is managed. The pace is being set by your subconscious mind. So it's not possible for a facilitator to make things go faster for you. This is very much managed by, a self-healing process. Patterns do break down gradually, right? This is a process. It is not a miracle. As I said before, MAP doesn't heal. We don't diagnose or treat disease. That's what you're doing with your other practitioners. What we are endeavoring to do in a series of MAP sessions is to create the conditions for healing. When we do a session on, let's say, a symptom, or symptoms subside, but then come back again, that does not mean that it didn't work. It obviously did, right? There was a change. Maybe it didn't last more than for a few days or a few weeks. What does that mean? It means that there's something more to this pattern. We need to look at it again. There are more triggers. There is more that needs to be uncovered, right? People are complex beings, and sometimes there are simple answers to things, there's a magic bullet, there's one belief, you clear it, wow, suddenly you're feeling so much better. But in most cases, if you've been alive for 3 decades or 5 or, 8, right, there's many layers of patterns that need to be looked at. Also, it's not necessary. So even though I've showed you in the paradigm, that there are traumas probably that need to be resolved, it's not necessary to know what they all are. This is where a practitioner can help you, can point you to help you remember or to access something that you might not be readily available to you. I work with many people that say, I don't have that many memories from my childhood, and that's okay. All right, I'm going to very briefly talk about some applications. So sensitivities, that was something I was working with as a nutritional therapy practitioner when I first certified in the MAP method. I certified in the MAP method because I wanted to bring this method of advanced neural retraining to address sensitivities. And particularly for people who have tried things like DNRS, basic methods of neural retraining, and it just wasn't enough. So with sensitivities, often what we see is that there are traumas from earlier in life that have informed the limbic part of the brain, that danger sensing part of the brain. The world is not safe, right? So then we already are predisposed to be kind of hypervigilant, hyper-responsive. Negative associations to things that we encounter in the environment, right? Almost like conditioned behaviors lead to sensitivities. And it almost seems like the more things that we become sensitive to, the more things we will become sensitive to. Like there's almost the pattern, once it's established, just becomes easier and easier. Like the tolerance for becoming sensitive to something becomes lower and lower. So how do we work with this? We, in general, work with memories and beliefs that make us feel not important, insignificant, helpless, powerless, defenseless, vulnerable, endangered. And through a structured set of MAP sessions, which is something that I put together in a program now, we can start to work through a lot of the common, issues and begin to work with incremental reintroductions, for example, for people who are sensitive to food. So I won't say any more about this, but I have a podcast and you can listen to a lot of different episodes. Many of my clients have sensitivities, whether or not it's the primary thing that they've come to me to work on. And so there are many episodes where people will talk about how the MAP session was helpful for their sensitivities as well. The first program I actually created was for long COVID. And this is because I had read in the newspaper that people were, practitioners were experimenting with anti-anxiety drugs and finding that use of them would shorten the infection, the length of infection and the severity, and also seemed to improve long COVID symptoms. And I thought, well, I know something, that can address anxiety, and that is advanced neural retraining. So for people who have chronic infections, we find that there are repressed emotions that are dysregulating the immune system. This can be from past traumas. There's so much that needs to be explained here, but in one of my podcast episodes, a recent one, episode 60, I talk about the molecules of emotion and how the work of Candace Pert, PhD, who was a neuropharmacologist and found that cells are studied basically with receptors that receive molecules of emotion from the circulatory system, emitted by the brain, but also emitted by actually every cell has the capability of making different molecules of emotion, and that these molecules of emotion coordinate all the functions of the body. So emotions are kind of a coordinating factor. And that viruses actually use those same receptors to enter the cell. And this is very interesting because it seems to indicate, and she talks about her work with AIDS, because, that a lot of her pioneering work was done in the 80s. She talks about AIDS patients and how she found that molecules of emotion, when they were absent, not flowing, repressed, stopped, whatever, inhibited, then they weren't present in those receptors to block the viruses from infecting the cell. Anyway, it's very interesting. It's just amazing to me that more people don't know about this work, but I think it has a bearing also on COVID. Anyway, so we can use MAP sessions to deal with long-term infections. Thyroid function. Thyroid function is something that I've worked with a number of clients that have low thyroid function because of the work that I've done with Dr. Kelly Halderman and her counterpart, Dr. Eric Balkovage. He has a practice where he works with people with thyroid, Hashimoto's, and cellular hypothyroidism. He also has a podcast. I was a guest on that podcast, and they wrote a book, and the MAP method is now mentioned in that book because the work that I did with Dr. Halderman. So anyway, they refer patients to me, and so I have worked with a number of patients or clients that have low thyroid function. You can hear some of their stories again in my podcast. All right, so the MAP method, applications, lots of applications. I am one practitioner. I happen to focus on chronic health issues. These are some of the things that I have worked with, that I've seen improvement in. Other MAP practitioners work in other areas. Some they focus on different niches. What I've seen, even aside from some of the chronic health issues, is that the MAP method or MAP method sessions are very helpful for relationship stress, work stress, personality traits or behaviors that you want to change, like perfectionism or procrastination. So it can be helpful on all kinds of levels. If you would like to learn more, I would recommend going to my website, and I will just quickly show you sort of where this information is so that you can explore it on your own. There are explanatory videos on that website. I know it can be a lot to try to grasp what this MAP method is and how it could possibly work. So on the homepage, I have 3 videos. The first one is the science behind the MAP method. Second one shows QEEG brain studies of a person undergoing a MAP session. You can see the brain activity that happens after instruction or verbal instruction is being given. The third one is a demonstration of a MAP session for a person with a phobia. So you get to kind of hear, what is it like to be in a MAP session? I also have, if you are curious about this paradigm I was sketching out before, and you want to understand the connections better for yourself, I have a little assessment that you can take. And I'll show you where that is. I also offer free courses about the MAP method. You can go to this other website, mapforhealth.us, to find all the courses and all the programs. So the free courses are like, what is the MAP method and how does it work? How do we use the MAP method for mind-body healing? And the third one is tips for more effective sessions. So you can go and explore, you can register for those, you can explore them on your own. There is so much more that I could say that I can't fit into, a 45-minute talk. So please avail yourself of those other resources if this interests you at all. And then I would just point out my podcast. So as I said, there are a lot of different episodes there that you can refer to and listen to. So this is what I was talking about, tcneuralretraining.com. This is my main website. I'm in the Twin Cities. That's what the TC stands for. And here you will find these 3 videos. This is about the science of the MAP method. This is the brain studies that were done on a person in a MAP session, and this is an example session on Leona's fear of flying. So someone who has a phobia of flying. Later, farther down here, you can take the quiz or the assessment that I was talking about that helps you to kind of make those connections between what traumatic experiences did I have maybe earlier in life? How is that connected to personality traits that I have? How does that feed into chronic health issues that I'm experiencing? So, all right. So I'm going to stop sharing now, and I'm going to let people just join in if they have a question that they would like me to answer or any comments. We have just a few minutes. It's later than I thought.
Hi, might you be able to put back up the slide with all the different conditions?
Conditions, sure. Just a
For a
second.
sec.
Yes.
Thank you.
Here. Yes, yes. Sorry. I was feeling the pressure of time. Let's see, and I have to make that bigger. Okay, is that the one you wanted?
Yes, thank you.
All right. Any other questions, comments?
I have a question. Oh, go ahead first. You can go first.
I was just curious as to whether this sort of type of therapy is good to have in conjunction with like other types of therapy, working on similar things, or if it's sort of good to work on kind of one thing, like if you're working on a MAP session, work on that for a while, take a break from some other, whatever else you're looking at. I don't know if it's good to mix and match or anything like that.
Yeah, so I would say that it is complementary to any other, traditional or alternative methods that you are trying. Now, for some people that are doing EMDR at the same time, or maybe some other kind of neural retraining, I would suggest that you leave about 24 to 48 hours between those sessions and these sessions, just so that there's a little buffer. It's not that they're contraindicated, but it's just we don't want to overwhelm the subconscious mind by doing too much in close proximity. Does that make sense?
Yeah, so it's something like tapping or something like that. Is that kind of similar in that regard? I've never done any of this stuff, so I didn't know if it's worth it to try something else concurrent with it, or if it just if that's a hindrance is what I was asking.
Yeah, I don't think something like tapping would be a hindrance. No.
Thank you.
Yeah, of course. Yeah, I mean, my hope is that by talking about the MAP method and my work, that I can inspire people to explore methods to work with their minds, in addition to whatever else they are already doing, because the mind, as I've seen, I'm lucky I get to see this every day, every week. The mind is a powerful thing. And if you haven't considered it, it could be that missing puzzle piece, that could be very helpful for accelerating the rate of healing. Any other questions?
Yes, I have a question.
Yeah.
Well, see, I wanted to ask you, I had a physical accident when I was about 15 with a lawnmower. And I wonder all the time if I would have been a better me, or if I would have gotten more done, or become more successful, or just better at getting things straightened out in my head if I wouldn't have had this accident, if I wouldn't have lost part of my finger or something, something that something's stopping me because of the accident from being the best me or from being perfect or something.
Mm-hmm. Yeah, so all kinds of traumas, right, can create patterns or blocks or associations for us that can be limiting, right? What you're describing is a physical trauma. It's not so much what happened to you, it's what your mind decided to make out of that, the significance that your mind attributed to it. And the nice thing is that though we can't undo what happened to you at 15, we can change the way that your mind regards that event. Does that make sense?
Yes.
That is what could make the difference for you.
And that can be possible. That could be actually happen.
Yes.
That, well, thanks. Thank you.
Mm-hmm. Yes, absolutely.
Do you think you could help me with that?
Yes, we could definitely do a session on that.
Oh,
Absolutely.
thank you.
Mm-hmm. Yeah, I mean, for you, it's the accident. For someone else who comes to me, it's, about the abortion they had, or a breakup that they had, or being fired from work, right? There is the event, but then there is what the mind does with it, right?
Yeah.
The things that we decide about ourselves or our limitations or what is or isn't possible for us based on that experience. So that's the kind of thing that we can work in a map session. I'm not saying that it's going to change in one session. Maybe it will. It just depends. Remember, your subconscious mind is in control of the session, and it sets the pace. For some people, we may have to revisit a couple of times, 2-3 times. For other people, things just happen, more quickly. And sometimes in certain sessions, you get farther than in other sessions. Again, it's all about.
Subconscious minds are stubborn. They're very stubborn and stuck in their ways.
They can be. They can be. Yeah.
Thank you.
Mm-hmm. Sure. Okay. And any other questions?
I have a question about your client's response between sessions. Do you notice, when you're dredging up some trauma or triggering events, that there can be a stronger response between sessions?
Yes. Okay. So what I want you to understand is that these sessions, as I said, they're very gentle, right? So we don't have to dredge up the trauma. For people who have been through truly traumatic events, and I work with many of them, unlike EMDR, you don't have to rehash the whole thing. You can just bring to mind anything about the experience that you're willing to put your mind on. And that's enough to get your subconscious mind in the right neighborhood for us to be able to work with that trauma. Mostly people are able to process the emotions around that trauma in the session. So every session, for example, your first session is a 60-minute session. And in that session, we always work with a painful emotional memory, like the kind that the last person who asked the question described. In the session, we are monitoring you through, so at the beginning, you'll say, this is what I want to work with, a memory of X, and these are the emotions I feel around it. When I think about that memory, I feel very upset, distressed, sad, whatever. And I have you rate it from 0 to 10, how strong is that emotion? And then as we go through, as we do the rounds of instruction, I'm having you revisit the memory again. Okay, can you bring that memory to mind gently again and feel into it and tell me, how strong are those emotions for you now? Usually within a 1-hour visit, a 1-hour session, the emotions around the memory are very much diminished by the end. So when someone reports that they had some emotions come up in between sessions or after the session, usually what's happened is that we've cleared a certain emotion, but another emotion that was repressed by the original emotions that we worked with comes up in the meantime.
Right, and that unblocking process. And so focus primarily on the emotions around it. Don't have them visualize it. I guess I was thinking of the EMDR and the way that the trauma response is between sessions.
Oh, okay. So I'm not familiar with that, but yeah. So sometimes, for example, someone will come and they'll have an experience and they feel a lot of guilt around it. By the end, they're feeling a lot less guilt. Why did I ever blame myself? You know, they're having different thoughts about it. But when I ask them the next time, you know, what did you notice as a result of our session? They might say, oh, I felt a lot of sadness. You know, I was kind of sad for that next day or so. And so what I will realize is sometimes we clear one emotion and another emotion that we weren't able to kind of access bubbles up. But it's not frequent. It can happen, but it's not like every session is like that.
Thank you.
Yeah, sure. All right. So we've hit time. I, as you know, have been recording this, and I will use this if the video is usable. I don't know. This is my first time trying to record one of these Meetup Zooms. And I will post the link in the chat, the event chat, so that if anyone wants to review it or share it, or anyone who wasn't able to make it today wants to see it, that will be there. So I hope that this has been helpful. I hope that at least it's gotten you thinking about the role of the mind and how it might be useful to work with that around any other physical health conditions that you may be experiencing. Thank you so much for attending.
Thank you.
Thank you.
All right.